Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Ogun State government goes beyond state's vaccination centres, hints of private sector engagement in vaccine administration. Governor of Edo State inspects upgraded School of Nursing and Midwifery in the state capital, hopes improved facilities will increase manpower in the health sector. And the World Health Organization warns that a lopsided distribution of vaccines will prolong the pandemic well into 2022. And that's where we kick off from. The WHO warning that the COVID pandemic will go on for a year longer than it needs to because poorer countries are not getting the vaccines they need. Dr. Bruce Aylward, senior leader at the WHO, says this means the COVID crisis could easily drag on deep into next year, as less than 5% of Africa's population have been vaccinated compared to 40% on most other continents. Meanwhile, Nigeria on Wednesday confirmed 167 fresh COVID infections. According to the Nigeria Center for Disease Control, Taraba recorded 109 cases, 65% of the total confirmed cases last night, and 2 persons were said to have died of COVID-19 complications. Here's more on the virus update.
167 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 9 states, indicating an increase from the figures reported earlier. Taraba logged the highest infections with 109 cases, followed by Lagos, which had 17. Plateau registered 16 cases, while Bauchi registered 11 cases. Rivers recorded 6 cases. Delta had 3 cases. Akwa Ibom and Imo had 2 cases each, while Bayelsa logged in 1 case. There were no cases reported from Sokoto State, while the latest data also includes a backlog of cases from Taraba State. The new tally has increased the total confirmed cases in Nigeria to 209,713. 178 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 197,724. Lagos accounts for the state with the highest number of cases currently on admission, followed by the FCT, Delta, Oyo, and Benue states. There were 2 additional deaths from COVID-19 complications in the last 24 hours, raising the fatality toll to 2,840. Currently, there are more than 9,000 active cases in Nigeria, while over 3 million samples have been tested so far. More than 5.4 million eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while over 2.7 million persons have been fully vaccinated. In Africa, there are more than 8.4 million confirmed cases, and over 216,000 deaths have been recorded across the continent. The total global confirmed cases have surpassed 242 million, while deaths are beyond 4.9 million.
In Ogun State, the government says it has so far vaccinated about 120,000 residents of the state as it contemplates introduction of private sector vaccination at a token. This was disclosed by the State Commissioner for Health, Dr. Tomi Koke, while giving an update on the current COVID-19 situation in the state. According to her, while targeting 70% vaccination among residents, the introduction of a private sector vaccination becomes imperative in order to ensure wider coverage, while same services could still be assessed in about 130 government medical facilities across the 20 local government areas of the state.
Currently in Ogun State, we have been able to vaccinate 120,000 individuals fully, both the first and second dose, 40,000 from Moderna and the 80,000 from AstraZeneca. However, the new development is from next week, we'll be introducing COVID-19 vaccination to the private sector, which means those that prefer to access the private sector for their vaccination could go to their nearest private clinic to be vaccinated. However, we still have the government facilities, which we have 130 of across the state, providing free vaccination The vaccination at the private sector will be at a small fee. This has nothing to do with the government, it's the facility that will be charging. And this is to ensure that we have a wider coverage of people. As we know, our aim is to have 70% of the population vaccinated in a very short time to achieve herd immunity and for us to be able to return to our normal life. As it is, we only have 1.5% of the population of Ogun State. We're 7.1 million, and only 100,000, 120,000 are currently vaccinated.
Into other states, the government believes that its upgraded and newly rebuilt School of Nursing and Midwifery is highly essential in building human capacity in the healthcare sector, capable of handling diverse issues which arise under the coronavirus pandemic. The state governor, Mr. Godwin Obaseki, who inspected the upgraded School of Nursing and Midwifery in the state capital, also underscored the importance of nurses in healthcare delivery.
As a government, our emphasis is on building the human capacity of Edo people. Healthcare, why healthcare? We are all witnesses to what happened last year with the pandemic and the unraveling of our healthcare system. How we could see how weak our healthcare system had become. Last year with COVID, didn't matter how much money you have. If you found yourself ill, sick, you had no chance of leaving this country, and so it raised the fundamental issue: can we continue to operate like this as a state, where we now seek for our healthcare needs from abroad or outside of the state? It is not that we don't have the requisite human resources. We do. We have more than 5,000 doctors within a 50-mile radius of Benin City. So it's not the human capacity, it's the facilities. And doctors are only one, segment of the healthcare chain. I think one key element to the healthcare chain are nurses who provide after-care services after the doctors have finished their own consultations and operations. And so for us, rebuilding a nursing school to an international standard is become, something that we cannot run away from. And this is what you are seeing here today.
Back to the southwest, where the government of Ekiti State says the fight against COVID-19 is still very much in force, as another round of fumigation of public places will be taking place around the state. The Commissioner for Environment, on the sidelines of a forestry inspection program, explains that efforts are being put in place at the moment to help check the pandemic and other epidemics that may be rearing their heads.
We have not gone on holiday. Even as at the time we are thinking we should go on holidays, when we thought that COVID-19 was subsiding, it picked up again. There is a third wave. Then there is another thing that we are suspecting that is moving around now, which is cholera epidemic. We are not, it's not yet time to say uhuru. We are not relaxing. We are still pushing up again. We have already put up our proposal for another fumigation exercise to take off in earnest. As soon, in another 1 or 2 weeks, we should be able to start all over again to make sure that we fumigate all our public spaces, all our schools, our public schools, and we also make sure that the proprietors of private schools also buy into what we are doing.
A breakthrough infection is an infection with a virus, bacterium, or other germ after you have been vaccinated. This is an expected occurrence for a small percentage of those receiving any vaccine. And since no vaccine, they say, for any disease is 100% effective in preventing infection, and this is in every person who receives it. But breakthrough coronavirus infections happen when someone who has been fully vaccinated for COVID-19 becomes infected with the SARS-CoV-2 virus. Well, joining us to talk more about this from our Abuja studio is Professor Mariam Aminu, Professor of Virology, Head Department of Microbiology and Deputy Dean, Faculty of Life Sciences, Ahmadu Bello University, Zaria. Thank you so much for joining us on the program.
Thank you for having me.
Prof, tell us, how common are breakthrough cases of COVID?
Hello, can I?
Yes, go right ahead. How common are breakthrough cases of COVID-19?
For breakthrough cases of COVID-19 is about 4% in populations, and it occurs mostly in immunocompromised patients. Majority of the breakthrough cases we have seen are hospitalized cases. They are about 4%. 4% of those cases are in cases that people that are immunocompromised that have comorbidity and underlying conditions, such as heart problem, cancer, those that are taking some immunosuppressive drugs. They are the ones, those are cases where we have the breakthrough cases.
There's still the argument of why get COVID even after vaccination. If you can help us to perhaps address that particular question, why?
Well, vaccination is meant to reduce the severity of infection and break the chain of transmission of COVID-19 so that we can get to herd immunity to prevent the population, the vulnerable. For breakthrough infection, it occurs only in those that are mainly immunocompromised. And even if you have taken the full vaccination, you can get infected if you continue to go about not wearing masks and abiding by the non-pharmaceutical preventive measures. So one can get vaccinated. It does not mean that if you are vaccinated, that you will not get infection. We want individuals to be vaccinated, fully vaccinated, so that they cannot spread the virus in the community to those that are at risk, those that are vulnerable. That is why it is important to get vaccinated. It does not mean that one will not be infected. It's just we want to break the chain of transmission and get to that herd immunity so that we can go about our normal ways. Because when herd immunity is achieved, you are protecting the individual. It's like a barrier you are creating. And vaccination is the only way we can achieve that herd immunity.
So essentially, you know, after vaccination, the coronavirus is not necessarily dangerous, but poses a major risk if there are underlying, you know, conditions. So tell us, what are the symptoms of COVID-19 after vaccination? I mean, you're saying that it reduces, but what are some of those symptoms?
The symptoms, the first symptom you will notice is sore throat. After sore throat, you have an headache, which is also common among those that are now fully vaccinated. We also have running nose. We have sneezing. Unusual sneezing is a very common sign of breakthrough transmission. And then the last one is coughing. Persistent coughing is very, very important. It's one of those symptoms of breakthrough transmission. But you have to watch out for that unusual sneezing. This is one of the signs of breakthrough transmission, unusual sneezing.
When you say unusual, is it for a longer period of time?
You know, when you sneeze once or twice, it's okay. But this one, you continue to sneeze and sneeze. It's more than common, more than the normal sneezing you sneeze. If it's unusual, you know that you may have a breakthrough infection. So along with the sore throat, the headache, the running nose, you should watch out for that, for the unusual sneezing.
Can someone be at risk for long COVID? And this is if the person gets a, what's it called now? The breakthrough coronavirus infection.
Yes. Majority of those that had risks with long COVID are those that are above 40 years old, women, and those with comorbidity. So the long COVID is majorly found in these individuals. Elderly individual, women, and those that are having comorbidity. Those that have cancer, HIV patients, those that have heart problem, those that are taking immunosuppressive drugs, they usually have this long COVID.
Finally, tell us about the link between achieving herd immunity and the breakthrough coronavirus infections, and this is in a population.
Okay, herd immunity, also known as community immunity. is like preventing the population from a disease when about 80% or above of the population have been infected with the virus or the causative agent, in this case, COVID-19. Herd immunity is achieved when we have a lot of individuals that have been vaccinated. With herd immunity, if we have enough individuals being vaccinated, it will reduce the breakthrough transmission, because breakthrough transmission have been found in 80% of unvaccinated individuals. So it's very, very important that people get vaccinated. If we reach herd immunity, it will break the chain of transmission. It will act like a barrier to prevent those that may not be vaccinated against the vaccination. So because individuals that are immunocompromised, they do not develop that complete immunity, enough immunity to prevent reinfection. That is why it is important that if a large number of the population are vaccinated, it will prevent individuals from having the breakthrough transmission, even if they are immunocompromised and they have taken the full dose and they are susceptible to the virus. So what is important is that large percentage of the population must be protected. They must be vaccinated so that they can break that barrier and break the transmission of the virus. So much so that those that are immunocompromised, that are susceptible to the virus, even after they have been fully vaccinated, because of poor immunity, they will not get infected. It will reduce the breakthrough infection if large number of individuals are vaccinated.
Professor Miriam Aminu, Head Department of Microbiology, Deputy Dean, Faculty of Life Sciences, Ahmadu Bello University, Zaria. Thank you so much for sharing your expertise with us and joining us on the program.
Thank you for having me.
As announced last week, South Africa has begun vaccinating 12 to 17-year-olds as it moves to boost its numbers. A single Pfizer vaccine dose was the recommended option for the age range by the Health Department. Channels Television visited one of the drive-through vaccination sites to see how the uptake had been on a school day.
We should be very pleased because we're following what the rest of the world is doing. So if you look in Europe, in France, Italy and Spain, 60% of their 12 to 17-year-olds have already been vaccinated. And the numbers are very similar in the US. So in many ways, because we've been a little bit behind the rest of the pandemic, we can watch and see what happens in other countries. And so we can then follow their lead. But we know that the vaccine is good. And in the beginning, it was really important to get our older people vaccinated, so the over 60s, and then the over 50s, then the 35-year-olds, then the 18-year-olds. And now it's time to do the teenagers. Teenagers can get COVID. They don't get it as many as the older people do, but we've seen children being admitted to ICUs. We've seen children across the world being admitted to hospital. And we've also seen children develop this long COVID. Don't know if you've heard about that. That's the one where for 3 or 6 months afterwards you have fatigue, you've got a headache, you can't concentrate, and you might even have lung disease. So we're pleased. We think it's good for the teenagers. We also think it's good because they will then not spread it to their families and their communities. So a lot of them, if you remember, we're not allowed to see their grandparents because of the risk of giving them COVID. So this way, at least, we're opening up the community.
Well, the impact of COVID-19 on small businesses has shed light on both the financial fragility of many of the businesses, especially in the weeks after the COVID-19 related disruptions began. Joining us to talk some more about businesses' expectations about the longer-term impact of COVID-19, as well as their perceptions of relief programs, in this case in the U.S., is Ekiti Asemotash, is a dance teaching artist, owner of 2 small businesses, Ekiti's famous fashion performing arts in Your Queen's INC. Thank you so much for joining us on the program.
Absolutely. Thank you for having me. How are you?
Very well, thank you. First, tell us, what was the impact of, as a business owner, the coronavirus, briefly, how it impacted your business?
Wow. So I'll start off saying I'm a woman of faith. That's what drives me in everything that I do. And so the impact was great in a way that it pushes us, we use that word many times during, especially 2020, pivot. So with being a woman of faith, I'm really truly inspired by Disney. I share this because Disney started during the Great Depression, and look at where Disney is now. And with my company, Your Queens, where we teach about African royalty through storytelling, song, and dance, I knew our mission and goal, even through every era in life, was to be consistent and spreading that we all come from royalty through storytelling, song, and dance. So it impacted us in a way that it kind of made us pivot and just trust the process through faith, where other doors opened us up for us to do even virtual experiences. A lot of our bookings that we did in person in New York City and even gotten to travel to different places in the US were canceled because we had COVID started February, March of 2020. That is a big time for my company, especially during Black History and Women's History Month. So everything was shut down. However, through faith, we kept on using social media as a platform, and now we have a talk series that we do every couple of weeks. So it kept us moving, and we actually grew and got closer and got more supporters worldwide during COVID.
Eki, the new normal, which is now, also how the government assist, perhaps with some sort of, what's the word now, benefits. Were there some benefits that government aided small businesses like yours? And what does this new normal look like for you?
It's a great learning experience, especially as a creative and as an entrepreneur, as an artist. So being able to get a small grant, and we were blessed to get a small grant, even with my small business, Eki's Famous was blessed to get a small grant. It gives us an opportunity. I see the world as I am here, as I continue to master myself. I want to help make the world a better place. So for government funding and other organizations that were able to provide funding for not only my company, for many companies, it kept us in a space to provide joy, to provide healing, and do our true work, especially during these times.
Tell us about the vaccine mandates.
Yeah, so vaccine mandates. Right now, where I am at this moment, as I'm continuing, I'm no expert educated myself, I do understand the importance of the mandate. There's so many information out there. However, I do feel like everyone has a choice, especially in the medical field and education system. I do believe that there are a lot of wonderful teachers who chose to not get vaccinated, who had to pivot, or again, had to shift and probably find other ways because of the mandate. From my knowledge, I know that earlier it was, let's get most people vaccinated. Now everyone has to, and it's kind of caused form of challenges and views and respect. I do believe that if we are left with the choices of having weekly PCR tests or rapid tests every week, and we have those choices, and until more people educate themselves and feel confident and patient, then we'll see a healthier world. So with you have the mandate, which is wonderful and great. Also, let's promote healthy eating, healthy lifestyle, getting our minds together. Because let's be honest, for someone who survived COVID, myself, thank God it was mild, because I live a very consciously healthy lifestyle. To each his own, everyone is different. To go through that experience and see how I overcame it, we should, because everyone is different. Everyone has their own choices, background, religious. There are some people that cannot get vaccinated because of health issues. I know personal people who are experiencing that. So I get the mandate. However, I do feel that we all have a choice.
All right, having those choices. Thanks so much, Eki Esemota, dance teaching artist, for taking out time to join us.
Thank you so much.
Meanwhile, India is celebrating a milestone of administering 1 billion COVID-19 vaccine doses, and the Prime Minister described the achievement as historic. Here's more on the global update.
India crossed the milestone of 1 billion COVID-19 vaccine doses administered after a slow beginning in the middle of January. India's immunization campaign has covered 3/4 of its 944 million adults with at least one dose, but only 31% with two. The government wants all adults to get vaccinated this year.
Huge congratulations to India for marking yet another milestone. 1 billion COVID-19 vaccine doses administered. The extraordinary feat in a short span was not possible without strong political leadership, intersectoral convergence, dedicated efforts of the entire health and frontline workforce and the people themselves.
The World Health Organization, which relies heavily on India for supplies to its global vaccine sharing platform COVAX, congratulated the country for reaching the landmark. The British Medical Association has accused the government of being willfully negligent for not reimposing COVID rules, such as mandatory face masks, as daily UK infections have been above 40,000 for 8 days in a row. Health Minister Edward Argar says the NHS is not under unsustainable pressure to justify restrictions, saying there were 95,000 beds in NHS hospitals, with 7,000 occupied by COVID patients and 6,000 currently empty.
Cases are rising, and yesterday we reported 43,738 new cases across the UK, up 16% from the previous week. And they could go yet as high as 100,000 a day. We're also seeing greater pressure on the NHS. Across the UK, we're now approaching 1,000 hospitalizations per day.
Continue to take responsibility. You can take a look at our website. It has the latest breaking stories, and also you can find a better understanding of the pandemic, as we have the latest there. Pfizer saying COVID-19 booster shot is quite effective. It's all at your fingertips, channelstv.com. Thanks for watching the program this evening. I'm Millicent Walker. Stay healthy.